Hey, everybody. Welcome to this week's Dentistry Unmasked. I'm Pam Maragliano-Muniz. Nice to see you guys again. And with me, as always,
Hey gang, David Rice. How are you, Pam?
I'm good. It's been a week. It's been a good week. New Year's being busy. I feel like ever since the New Year struck, it was like, I don't know, people are like making up for lost time. You take a couple days off and now you're just bombarded with things. How about you?
I feel like raise your hand if you have no idea what day of the week it is because of the way the holiday fell.
Exactly.
Yeah, with that, hand raising over there in the blue shirt. We have a really great guest today, don't we?
Yeah, we do. And I'm so excited to have this conversation because I want to learn from her. And I don't know, like you guys will see, like you're going to want to be here.
You're totally going to want to be here. So, welcome, Teresa Power.
Thank you. Thanks so much for having me. Really set me up for success here with that intro.
So I met Teresa at Greater New York, I guess not this past one, a year ago. So I've met you a while back, and you guys will see Teresa's got this all the energy and a cool background and is an expert on sleep. So can you share a little bit about your background and kind of how you've made your place in dentistry?
Sure. So I'm not a dentist or a physician, but I do have a clinical credential. I'm board certified in clinical sleep health. After many years of sales and consulting work, I was in orthopedics, then I got into dentistry, dental implants actually. And when I sort of stumbled into dental sleep medicine, I was like instantly obsessed, hooked. This is 100% what I'm doing for the rest of my life if I'm lucky. So I got into dental sleep medicine working for a manufacturer of oral appliances. And if anybody has ever heard of it, I'd be shocked because I was like really honestly shocked myself that like so many people have sleep apnea, so many people snore. It's so common. Nobody knows what to do about it. And dentists can make this incredible, life-changing device for people that, again, most people just didn't really know about. So I started an initiative with that company to start connecting dentists and physicians more. They really need to be connected and collaborate to actually test and treat patients. So that was really interesting, and I really stuck with that. Eventually, I wanted to do more, so that's when I started studying and doing overnights at the sleep lab, shadowing some clinics around here to get my credential. And that's when I started Sleep Better NYC.
That's awesome. So, okay, you kind of mentioned how prevalent this issue is and how few people know about it. Like data, basic data.
Yeah, I mean, depending on what study you're looking at, over 20 million Americans have obstructive sleep apnea. They say when I went to World Sleep 3 years ago, they said several billion people worldwide have sleep apnea. You'll see this number all the time if you're in sleep medicine, that about 80% of people who have sleep apnea are not diagnosed or treated. And that number is a staggering 90% if you are a woman. So that doesn't mean 90% of women have sleep apnea. It just means if you are a woman who has sleep apnea, there's only a 10% chance that you're actually being treated for it.
That's
I
scary.
believe that we tried to implement, are implementing sleep in our practice. And so when we had our training, I had my whole team trained at the same time because I think that bringing sleep in is not just for the dentist. I feel like it's something where the whole team needs to be involved and everybody really has a role. And so in our training, we almost, not all of us, but most of us went home with a sleep test. And literally every one of us that went home with a sleep test has some sort of sleep disordered breathing.
It's super common. And I mean, for a lot of reasons, I think there's this stereotype because it's much more of a higher risk if you're a man and if you're overweight and if you're older, all of those increase your risk of having sleep apnea, but it sort of has, I don't know if you can pigeonhole a disorder, but it's sort of like pigeonhole this disorder as to be, people think it's like this old white man like falling asleep on the couch, but it can be anybody. And women, especially as we get older and our hormones change and often our bodies change, it increases the risk as well. So it's actually more likely for an older woman to have sleep apnea than a younger man.
That's fascinating. So, okay, if there's all this prevalence and so few people being treated, and I'm a dental practice today, and I get that. Like, what are my very first steps? Because it feels like people who do get into this fall off the wagon, or they just don't think it's worth it. It feels so insurmountable.
That's a really great question and sort of a loaded question too. You're right. I have worked with hundreds, hundreds of dentists, hundreds of physicians, and it is difficult for dentists to stay the course, I would say, with dental sleep medicine. And mostly because it's just so different. You are treating a medical condition. It has a whole list of rules and protocols that are totally different than everything else you're doing. It absolutely requires your entire team. I personally think that the hygienists and the assistants should be doing most of the work aside from actually delivering the device. But that takes a lot of commitment. Um, I think that if we think about it in a different way, like David, we've talked about this before, just at least just start screening. Just ask a few questions. There are clinically validated questionnaires you can just add into your intake forms. Just do that in the same way that you are screening for oral cancer, but you're probably not treating oral cancer in the same way that maybe you refer out for perio or root canals or whatever else. It's totally fine to also screen and then refer out for sleep apnea if you're not ready to totally jump in.
What advice do you give to dentists that want to bring in this questionnaire? And so, say they bring it in, patient fills it out, they clearly have a problem, and now we're trying to have this conversation, but we might not feel confident in the implementation on what to do. And the patient's like, why are you even asking me this? You're a dentist.
That's super, super common for sure. I would start sort of like planting the seed. Again, it kind of takes work, but if you add just a few questions here and there in your intake form, sort of start to plant that seed, get people thinking about their sleep, most likely they still will have that reaction like, wait, why are we talking about snoring? You're like doing my cleaning or fixing my cavities, whatever it is you're doing. But it's important to at least know the basics and say why we're asking these questions, even if those are the only answers that you know. There's something called the Epworth Sleepiness Scale that should be filled out for people to screen for sleep apnea. It's also required for insurance purposes. There's only about 8 questions. So if you know the answers to just those 8 questions, why are we asking how sleepy this person is? You can let them know that there are some signs and symptoms that you might see. There are some signs in their mouth that might indicate that they might have some breathing disorder or just some breathing trouble in general. And you guys would see that anyway. And you can let them know that I'm going to see this anyway. So I just want to see if it's related to something else, whether you treat it there or not.
Well, you can't see what you don't know, right? So, what types of, what do you want to say? Like, what types of symptoms or what types of presentations might we be able to identify while we're performing a clinical exam that really might not be a dental cause of whatever we're seeing? It could be sleep. What should we be looking for?
I think the most obvious is teeth grinding and bruxism, which is something that you would almost always notice as a dental professional. There are different philosophies, but more and more we are finding that bruxism is very closely related to sleep-related breathing disorders. Of course, there are other reasons, and a lot of people just think it's stress, and they are shocked to find out that it is actually an indication of a breathing disorder. Scalloped tongue, which may also be related to that bruxism. Potentially, it's also because a person has a big tongue that can block their airway. Other larger soft tissues, just like big tonsils, uvula, again, just more tissue back there will increase the chance of it blocking your airway. At the very bare minimum, if somebody doesn't have sleep apnea, but they're snoring, although it's kind of unlikely, but if they're just snoring, even that can be an issue. If they have these soft tissues back there vibrating, that would mean that the air is going by the soft tissue and it's causing this vibration sound and causing the snoring. And why would that happen? That's not a natural, normal, healthy thing to be going on. So these are signs, these are things that you would physically see.
So, Pam, what do you think about this? Because I feel like that's a really great gateway for dentists. we've gotten pretty adept at rifling occlusal guards out there left and right for people who, grind their teeth for whatever reason. It's almost become this adjunct procedure that happens in hygiene and lots of practices, right or wrong, another story. But if we know that there's a high correlation between airway issues and people who grind their teeth, like, is that a simple way to get hygiene team members and assistant team members to start having that conversation and introduce that, that Epworth?
I think though, I think so, as long as they have the education and they feel confident having that conversation. So I know it's so uncomfortable and nobody likes to do it and it's a little bit awkward, but I feel like role playing and, kind of having a general script on what to say and why we're looking for the things that we're looking for, because I think there's also expectations from society and from our patients. You grind your teeth, you make a guard, like they're like, or if they don't want to pay for a store, a guard that's made in a lab or printed in a practice, they feel like it's the same thing if they go down the street to their local pharmacy and pick up a boil and bite kind of thing. And they don't really get that there's a difference between that and what we fabricate. And now we're saying, this big hunk of plastic that you've been wearing all this time, I want you to now wear two, one on the top and one on the bottom. And so I think that there's some elegant ways to have that conversation. And also, I think it's because of education that's going to help us, because I think that whether the patient realizes that there's a problem, they probably recognize that they wake up in the middle of the night to go to the bathroom, or that they wake up and they're still tired, or, they're in a dental chair for an hour and they're sleeping for 40 minutes of that appointment, when they should be awake. There's things behaviorally that they probably don't realize is because of poor sleep. And so I think it's our responsibility to try to create awareness, because if you're just trying to sell a sleep device without that education, I think you're setting yourself up for failure.
100%. And the good thing about sleep is that quite literally all of your patients do it, and a lot of them are bad at it. So it is sometimes an easier conversation to have, even if they don't know the direction you're going in with that. I think it was a really good idea to have like sort of that script, maybe just top 3 to 5 questions. As you get into dental sleep medicine, you will realize that they're asking the same questions over and over again. They have the same misconceptions over and over again. So if you have like sort of an FAQ, that would be great. There's patient education materials. There's a ton of stuff online. I make some items that you can give to your patients and download. But even just knowing the basics, because, as soon as they leave your office, they're either going to forget or go look at Google, and who knows what kind of stuff they're going to find there. So even just like a brochure or something to hand the patient with some general education information is more than they have on their own.
That's a really great point for if you're, a dentist or a team member here and you're just like, I really get this, but I don't know how to open that conversation. To simply have information to give to a patient and say, go home with this and spend a little time and see what you think is a step.
So say you have the conversation, say you get the patient to, whether you have a sleep study that you can dispense in your practice or you send them off to, one of the other ones that are out there, and they go get a sleep study and they come back and they have a problem. I feel like as a dental professional, there's a few obstacles that we have to overcome. Number one, there are so many different devices out there. And I think that, I feel like as a prosthodontist, I want to know all of them. And then I want to know why I want to give that one to that person, that one to that person. For me, a one size fits all just doesn't sit well with me. And I think a lot of dentists share that sentiment. But then also, they're more expensive than, say, a night guard. And so, but I'm your dentist. So now I'm recommending this device, and say in a year or two, you need a crown and now your device doesn't really fit anymore. So now what happens there? So I feel like there's all these questions and a lot of ways that dentists kind of decide why we should say no to bringing this into our practice before saying yes. Would you help with some of those obstacles?
Ew, I mean, there are legitimate obstacles. There are a lot of obstacles bringing us back to why dentists don't do this. On one hand, I know some dentists who only do this or they use it as their retirement plan, basically. I know a dentist who actually practices here in Manhattan, I believe twice a month, and then he flies home to his retirement home in the Midwest, and he makes enough money to support that lifestyle because he's only doing sleep medicine. But he has had years and years and years of overcoming these obstacles and getting the referrals and understanding how the insurance works or his fee for service, whatever it is. Um, Cost, unfortunately, is one of the biggest barriers, but I think it's also one of the most complicated or like least understood. For the most part, almost every insurance and slowly even some Medicaid programs are supporting or covering oral appliances. Of course, that requires significant documentation and no mistakes in your documentation. But it is really helpful, and that's kind of an easy way sometimes to start with patients who are very nervous about the cost to say, this is most likely covered by insurance. Now, everybody's plan is different and everybody's out of pocket is different, but at least that gives them a little bit of relief to say, we can probably get insurance to cover this. Now, with high out of pockets, you might even be doing somebody a favor by saying, you know what, we have a cash pay option too. I'm sure you have something like Care Credit or Cherry or whatever it is that you guys use. Dentistry can be really expensive sometimes. So this is another thing that you just have to talk to them about their plans and their financing options. And I think when you're talking to patients too, you have to, like you guys were saying before, not just sort of like sell them this widget, this device. We have to think about why they need it. I know that some patients respond really well to like the science of it and what's going on in your body. Some people don't want to hear that their heart attack risk can increase. Some people don't want to hear that they might have a stroke. I mean, you have to sort of read the room a little bit. I was in with a patient years ago, and she was there with her mother. No, the mother was the patient and the daughter was there. And the mother had had 2 heart attacks and she had grandkids. And so the daughter was there saying, I need you to do this because I need you to be around for the grandkids. Now, again, I'm not saying like tell your patients they're going to drop dead, but maybe lean into that a little bit. We want you to get this because your daughter had mentioned, you know, you need more energy to be around your patients. We can lean into that a little bit.
That's really fascinating, your story, because there was a study, I think it was done your way, Pam. I think it was a Boston University thing. And they studied long-term, they studied yes by patients, and then long-term kind of patients stuck with the program. And it was with cardiac patients, and they focused on the positive outcomes that could be. And they showed like a much higher prevalence of people saying yes and then following through than when somebody said, you're going to have a heart attack and die. It was more like, you're going to be healthy and live for, when we took the time to learn those things. That was kind of a cool study.
I love that. I think that's so important. And it's, you know, it's really hard to tell someone like, if we're talking about heart attacks, your risk goes up, but like, you don't really feel that you're having a risk. You know, you don't feel like your heart is stressed. So it's hard to really compute. But if you're talking about your energy levels or, you know, quality of life, or you're not going to fall asleep at the wheel, driving your kids to soccer practice. I mean, those are all pretty important.
No, it absolutely is. Well, I'm going to share my obstacle. Okay. So I bring this into the practice. We all get tested. I get this surprise that I'm, half dead when I'm sleeping. And I'm like, all right, I'll play along. Let's make a device. So we make a device. And I'm not going to lie to you, Teresa. I freaking hate it. I hate it. I hate it. I hate it so much. Like, so much. To be honest with you, my TMJ is like an absolute nightmare all day long with it. And it would literally take me all day for my occlusion to come back together, that finally I was like, F this thing. I can't wear it. I choose death. I would just enjoy my heart attack and I'm just going to die. But I don't, because, I'm one of those like, do as I say, not as I do. We still screen for sleep. Every device I've made so far, I'm going to knock on a little wood right now, patients love it. And I'm like, am I a delicate flower? Because when I deliver these things, I'm like, here you go. I hope, if you need me to adjust it, like I'm inviting them to adjust it because I've adjusted mine so many times and I still freaking hate it. So I'm just like, I tell you, I was sleeping better, but for me, the positives did not outweigh the negatives. I had to just let it go.
Well, I mean, it's good to be open and honest about it, I guess. I don't know if I would lead with that with your patients. Um,
No. No, but it's like I wanted to love it because I mean, we all want to feel better. We all want to sleep better. We all want more energy. We all want to like not have rings and wear more concealer. Like we all want all of those things. But I feel like like I could not. I literally went with the pain for several months and finally I was like I just need a break. And I started like stop. Like I was like I'd wear it a couple nights a week, and it's still like I'd be like, oh, my TMJ feels great. I'll wear it and be miserable tomorrow. Like that's kind of what I was scheduling. And I feel like clearly I don't have the right device. I probably would benefit from a different device, but like I don't have the experience to know why this device didn't work for me and why maybe another one would. And if I was my patient, I'd be really disheartened, really annoyed by this whole process. And I'm kind of glad it happened to me and hasn't happened to me as a provider.
yeah, I mean, yes, to that last part, especially, that could definitely be a limiting factor for dentists. I would say that, yeah, most likely you have the wrong device. It should not should be, but it's very common to be very uncomfortable. A lot of people drool a little bit, they have a little bit of soreness, but pain and lasting pain is absolutely not supposed to happen at all. I'm amazed that you tried it for so long. Um, you might need a different device. You could potentially even adjust the device you have. You might want to work with either the company or somebody else who've used that device before. Of course, that is a little bit harder when you're talking about patients, especially if they paid for it already. You have to make a whole new custom device. So yeah, I mean, you were saying before you want to use different devices. Even when I was working for a company that manufactured them, I would expect that most sentences would use different types of devices for different kinds of people or different conditions. For some people, when they choose the right device and it's adjusted properly, it can actually help improve signs of TMJ. So it's sort of the way other side of the spectrum, which is not what you were experiencing. So unfortunately, I think a lot of it has to do with the kind of device, but it would be hard to go back to a patient and say, well, it's not working for you. Let's try again, because that could incur costs. So I could definitely understand that issue.
So I have a question because Pam, I know you had a really amazing dentist, work with you on that. But so if I'm new to this, or maybe I've been in this a little bit, what and Teresa, you're well connected. So like what clinical CE should I be seeking out that maybe can say, hey, here are X types of devices, and maybe here are presentations of patients that might lead you down one path versus another?
That's a great question. There are a lot of like weekend courses which give you a ton of information and they like really motivate people to get started, but they wouldn't necessarily go down that route. And even if they did, it would be hard to really wrap your mind around it if you haven't seen a lot of patients. I think unfortunately a lot of it comes with experience, but I like CE that is offered by like external groups or bigger programs in general versus just coming from a manufacturer. A lot of manufacturers do have a lot of different options. Rarely do they ever sell just one device, but the materials are going to be different from one manufacturer to another. There are different materials as far as comfort, but also allergies. Of course, again, sometimes insurance plays into it here, but I'd really recommend trying to do a course that is longer than just a weekend.
That's the perfect answer. We cannot weekend warrior this. Or, I mean, Pam, let's be honest. Like we've had this conversation with multiple topics of you can't just go to one weekend, expect to come back an expert and have all the answers. And the danger doesn't really lie in when it goes well, but I think your exact experience is like what if the danger lies in like what happens when that patient walks in who can't tolerate it or has a negative experience.
Now,
No, I
there
think it's really challenging. So what types of organizations do you point people in direction to get that education?
there are a bunch of really good ones out there now. I'm sort of out of the loop a little bit, but There are companies, oh my gosh, who am I thinking about right now that have like a coaching? Awaken to Sleep is a really great organization. There are some billing companies like Nearman Practice Management. They have a software for billing for dental sleep, but they also do a lot of, they do like more comprehensive programs as well. I believe Panky has something that is a little bit more of an intensive. There are even some mini residencies nowadays. Of course, that doesn't help you if you're out of school, but it is becoming a lot more common for people to want to specialize in it.
That's
So
very
what
cool.
about what you do? So I want to hear a little bit about Sleep Better NYC. So, I'm a dentist, I own a practice, I'm calling you up and I'm like, tell me how you can help me.
Well, I was doing individual one-on-one sleep coaching for a while. Because of my background in sleep apnea, I have a small team of coaches, and we specialize in what's called remote patient monitoring, where it's basically sleep coaching with data. You're tracking patients every single day on CPAP and some on oral appliance. We did just stop that program recently. So I do help to teach other people how to do that, but I also have created some patient education materials to give to dentists to help their sleep champions, help their patients, and just sort of walk them through the process, or some tips and tricks that would be more helpful for them.
We need it
And
desperately.
everybody needs it.
Desperately. So so SBNYC, like what's your focus today?
Oh, it keeps evolving.
That's all right.
Primarily education, collaboration, connecting people. Thankfully, I do have this perspective and sort of varied experience working with patients and clinicians and physicians and doctors and dentists and all different angles, which I think is really helpful in connecting people. I can't do it all on my own. I do have other things that I'm working on as well. So I'm really into collaboration and connecting people with the right clinician. Um, a lot of what I do is on social media, and it's specifically for that, just to give people education to cut through all the noise online, all the crazy stuff you see. I'm like inundated with ads for things that are just absolutely ridiculous that I know people are spending like hundreds and thousands of dollars on. So I'm trying to just educate and give people resources and connect them with clinicians who can actually help them.
So you work mostly with patients slash people as opposed to dental offices telling them, helping coaching the office to effectively get a sleep um, program in their practice.
I do. I do offer like not weekend courses, but more one-on-one sort of like webinar scenarios for the big basics and walking them through. And then I'll give resources after that, just to be conscious of time, really. But not as much like one-on-one consistent coaching. There are other programs for that, which I could connect you to.
I love that. For me, like objective truth is valuable and rare. So I appreciate you being here, because I think what we're getting today as dentists is just objective truth. There's no skin in this personal game from a dentist perspective. And I know I follow your channel on Instagram, and as a lot of the young docs at Ignite do. And dentists, it's a great place to send people, your patients, so they can learn things that are true. And that sort of brings us full circle to that. How do I bring these conversations up to people in the first place? Well, if they're constantly learning a little bit at a time from an objective source, our job gets a whole lot easier.
I mean, I
Couldn't
agree.
agree more. Couldn't agree more. Well, Teresa, where can we find you? Where can we follow you? Where can we direct our patients to learn from you as well as us?
I am on all forms of social media, but primarily Instagram at Sleep Better NYC. No dots or spaces or underscores, just Sleep Better NYC. It is also my website. So I give tons and tons of free tips and tricks on Instagram. And then they can also click to either buy a download or get in touch with me so that we can make patient education materials specifically for a dental or medical practice.
That's amazing. Well, thank you so much for sharing your insights and the necessity that we really need to bring this into our practices and share this with our patients. And thank you for listening to me complain about my device.
No problem. Let me know if I can help you in any other way. I'll give you other
Oh, I
unusual.
will.
I feel like there's one-on-one quality time that needs to happen there. So Pam, you don't die that slow, torturous death.
Yeah, let's try to avoid the death part, at least early anyway.
Yeah, no, exactly. So, yeah, I be calling you. Don't you worry.
Perfect.
Teresa, thanks for being here, friends. Thanks for listening and tuning in to another episode of Dentistry Unmasked. Until next time, gang. Cheers. Thank you, everyone, for watching or listening to the show this week. And thanks to our guests and sponsors on this episode.
Please check out our social media at Dr. Pamela_Maragliano and at Dental Economics Official.
Or you can check me out at Ignite DDS or at Dr. David Rice.
And go to dentaleconomics.com to receive dental economics. You can choose to receive DE in print or digitally, and you can also get the details of our Principles of Practice Management conference on our website.
If you have topics or guests or anything you'd like to talk about on the show, send us an email to dentistryunmaskedpodcast@gmail.com, and we will do our very best to make it happen. Thanks again, and we'll see you next week.